Okay, you're going to start with the shoulder adducted, abducted, so it's across the midline, okay? Basically, you're starting with the hand near the opposite pocket. Shoulder adducted, relatively extended, and internally rotated, okay? The elbow can be flexed or extended. It's going to be hard to get full extension here. And then the wrist should be, I believe, flexed, and then ulnarly deviated. So the thumb is technically pointed down, but you have a little bit more of that pinky in the air effect. Okay? So thumb down, pinky up, but you're up. You're across the body towards the opposite pocket. And I cue the patient like you're going to draw your sword out of your pocket, and you're going to bring your arm up and out, and you're going to release the dove, which is shoulder flexion, abduction, external rotation. The elbow goes from, I think, a relatively extended to a little bit of a flex position. And then, this is a great one for waiters and waitresses too. We work on this for carrying trays sometimes. And they're going to go into relatively wrist extension and radial deviation. Release the dove. Pull your sword out and release the dove. So, let's practice. Why not? So we want to lie down here. This one's a little harder for me personally, I think. Hard. It's hard to move up across someone's body. I think. But come just a little bit closer.
Not that bad yet.
Okay, so don't worry about the quick stretch or any of that stuff yet. Just remember to cue the patient to relax and to try to visually track their arm when they're doing this. Okay, now this is tricky, man to woman here again, okay, so I have to be careful. I'm not going to probably have my hand in the most ideal position to really cradle that arm because of where the contact might be. I need to cross midline. So my hand's actually not going to be in a very advantageous position, but relax. So same thing, lumbrical grip. I've got to maintain wrist in flexion and ulnar deviation. Okay? So again, one hand proximal to the elbow, in this case cradling in a more superior way, which isn't ideal. I'd rather be underneath, but for this purpose I'm not.
Like a thin pillow?
You could, yes. I've done that before, but I can probably work around it. Now relax, you're not relaxed. There you go. Okay, so in this one, you can either do the pivot here on the balls of your feet. For this one, sometimes I will slide my proximal hand down and take over and switch hands, which may be complicated for a novice. Okay. Okay. Or you can do the relax lunge position. This is really hard. You have to have a really high table. I do have this at my clinic. I've done this for resistance, where I raise it up a little higher, and I'll have it come up and out and down in like this for resistance. So you can do this. I don't like it as much. So my suggestion to you is to either do the pivot, relax, you're not relaxed, to do the pivot. So again, I'm just kind of rotating my thumb around as I move. So I start with the lumbrical grip here to maintain flexion ulnar. And as I move, my hand slides around to facilitate wrist extension and radial deviation. Or if you really want to show off, you can do the slide and switch. But again, notice how I'm always maintaining contact, always. But you lose a little control during the rotational component if you switch. But if you're going to do that, you always maintain contact. You never dig in with your fingers as you slide, because you have the potential to compress that cubital tunnel and give them an ulnar nerve rotation. Relax. You're doing alright there. Okay, so the hardest part with this one, as you come up and out, is going to be to change from wrist flexion and ulnar to wrist extension and radial. Okay? It's going to be hard, but practice that. Okay? Okay, watch your hand as it comes up and out. Okay, thumb pointed down here. It's going to point up and back. Okay, let's practice D2.